Well, I'm OP Yadav. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. Any surgery in which the sternum is not slit in the center and we approach the heart using small lateral thoracotomy or the anterior thoracotomy, what is also called as the last operation or the MIDCAP operation. All these names have been used. All these surgeries are called sternal sparing, minimally invasive surgeries, and they can be done typically for single vessel coronary artery disease. For example, if you've got an LAD stenosis, you can give a lima to the LAD through a MIDCAP incision on the left chest, or a single vessel right coronary artery. You can enter the chest through the right, third or the fourth intercostal space. And nowadays, with advanced heart stabilizer systems, rule tract retractors, as well as the non-sternotomy, starfish and other operating systems, we can do triple vessel bypass surgery without opening the chest through the sternum.